Good afternoon, everybody. It's lovely to be here. My name is Loretto Grogan. I'm the National Clinical Information Officer for Nursing and Midwifery in the HSE. So I'm just going to talk, the next three slides are a little bit in terms of setting context of why we need to get this right. The first slide is a slide that I integrate into most of my talks. And it's a really simple slide, and it just talks about people and patients. So we're all people. We'll all be patients. So they're at the core of what we do every day and why we do it. Again, I talk about most of us live at home. We live in the community. And we use other services when we become too unwell to be at home or need a specific intervention. So we're one person. We journey through acute and community care. So I really try to highlight to colleagues, and particularly when we're thinking about our data moving forward, standardisation, that we need to think above the acute setting or the community setting. We need to focus on the patient and how we're going to manage that data going forward. And health and well-being, it's a key building block for society. Being able to enjoy good health and well-being is a right of every citizen in the country. The next slide, I know we've all seen this many, many times, is our Sloan Care, our national policy. You can see Strategic Action 10 is our e-health infrastructure and getting that right to connect our health services and also to digitally connect our citizens to our health service. And this is key going forward. And that whole getting our EHRs right, getting our data right is a key part of getting our Sloan Care strategy right. If we don't enable for integration, if we don't think of that bigger picture, that patient-focused data, it'll be a real challenge to get that right. And the next piece is our healthcare data. It's a challenge. Even from a nursing and midwifery perspective, in terms of location, we have data everywhere. It's in filing cabinets, it's on desktops, some of it's in EHRs, some of it's in different digital format. Our data format, some of the data is structured, unstructured, some of it's in PDF, JPEGs, regulations and requirements. We all know about GDPR and regulations, and this can be it's a challenge and an opportunity at the same time. Data complexity. We're trying to get data from humans into a kind of data warehousing or a tech environment. Our data definitions are a challenge. And that's something I know that we're starting to address. And we can have a challenge like a broken hip could be a fractured hip or it could be a hip fracture. So then when we go to look at that from a national perspective, how do we analyse that? And then our data structures. We have data that some of it is very structured, some of it is unstructured, and it's actually managing all that. So from a nursing and midwifery perspective, what we will do. The Office of the CIO have a 5-year strategic goals. There's 8 goals. So what we have done in nursing and midwifery is we have developed a roadmap for digital nursing and midwifery and aligned those goals to the Office of the CIO's goals. So our first goal is empower citizen-centric healthcare. So what we will do as nurses and midwives, and again, this is just hot off the press. I only presented that to our corporate colleagues last week. So we want to initiate a national conversation with people who use our services and their families to understand how they use and how they want to use technology to support and manage their health and well-being. We want to develop systems of engagement to incorporate the people who use our services input into an ongoing experience of digital services. And this has all been cognizant that we haven't always been good at doing this. We want to identify new and emerging technologies shaping the future of healthcare delivery for our patients and our service users. We want to utilise digital solutions and products to enable improved and more efficient person-centred care. We want to advocate in partnership with people who use our services to find the most appropriate digital solutions. We want to establish methods and systems to manage patient-generated data. I get so much feedback from colleagues that patients are now coming into clinics, say from my colleagues who are specialists and advanced practitioners. They're actually managing their own information digitally. Or else they have an app, it may be regulated, it may be an unregulated app that they're using to get information from or to add information to. So they're presenting at clinics and they have all their own information digitally somewhere. So again, it's our challenge to actually work with patients and put a plan in place for how we're going to manage all that. Now we don't have, like I said, this is just hot off the press. So in the next number of months, we would really appreciate a conversation with how we're going to initiate that national conversations. And that will be done in conjunction with our other clinical colleagues and our technical colleagues. So this is a core piece of what we hope to do. That's only a goal. There are 8 other goals that I don't have time to go into. But hopefully that'll be published in the wider arena in the next month or so. Again, what right will look like, and I know everyone has spoken and touched on this morning, information follows the patient. This is key. We have case scenarios, particularly some with multi-comorbidities, where they have several providers, and it's actually having that information and having access to that information for things like medication, reconciliation, adverse events, etc. The comprehensive picture of health for the patient and their families, and again, say for end-of-life care and other case scenarios, this is actually so important. Empowering patients to manage their own health, facilitating self-management, shared decision-making. I know a lot of my colleagues really want to actually have that platform where there is shared decision-making and where they have information to enable that shared decision-making, because currently that is a challenge. Information is not in one place. And a partnership approach to delivering healthcare, and particularly in terms of Sloan Care, that really is important that we all work as partners. We'll have more engaged and informed patients and citizens. The right data for the right patient in the right place, the right time. And I'm going to move on because I've just been shown the red card. Improved patient-clinician relationship is a key thing. And I know all of my clinical colleagues, they have a challenge with documentation, with time, making time to actually really sit down and work on that patient-clinician relationship. To conclude, I think we're at a unique juncture in the history of healthcare with the convergence of EHRs, biosensors, genomics, and other digital advances. We need to make sense of the overwhelming amount of data created. I think there is a remarkable potential for digital healthcare technologies to positively impact care if we get it right. I really think there is. I think we're at a unique juncture. Sometimes we don't always see that, and we have a big opportunity. And we really need to work on this journey together. Patients, clinicians, technicians, nurses, midwives, doctors, all of us, to get it right. Thank you.